Colin, really thank you for coming and talking with us today about monoclonal antibodies. We've spoken before, but what's really, exciting to me is to be able to get the word out. You're someone that people know, a name they recognize. And if most people don't know that monoclonal antibodies is probably our most effective treatment we have early on in COVID. It's the one treatment that we have that prevents hospitalizations, actually 75% reduction in patients at risk. And where it normally takes a couple of days to weeks to start developing antibodies, which are your body's natural immune system to fight the infection, the antibodies really give you a jump on it and allow your body to fight off the COVID before it causes the damage. So getting the word out is really important. So I'd love to talk through your experience and how you got COVID and how we got to it. So thanks for taking the time and talking to us.
Sure. Thank you again, doctor. And it's great to see you. I got COVID from doing a live podcast with younger comedians, which is actually relevant because they got COVID, and the COVID, whatever strain they gave me or I had, they got devastated. I just felt bad. Like 2 days later, I started getting a cold. This is in around Thanksgiving. And I started feeling like sniffling. And I was like, oh, no, I can't have COVID. I can't have COVID.
What concerned us was when Dr. Goldman called us, your doctor called us, is that, you were already a few days in, you had underlying conditions, and we've seen a lot of patients like you deteriorate. I met you already after you were already sick, but when did you get, you got tested, and then how did you find out that that this was available? Who told you?
I called my doctor, and then he said, you're eligible. And then he set the whole thing up. You know what I mean? That was a good thing, Dr. Goldman. So he said, you're eligible, so you can get in there and have it. So I went up and got it. And I wasn't even going to go. At first, I was like, oh, it's a hassle. I don't know. It's all the way uptown. I didn't even want to go out. Remember in November, people didn't want to go outside in the city, It was my heart doctor. So I take, you know what I mean? I knew he wouldn't do something that would jeopardize my heart, And he said, this is available. I can get you the treatment. Do you want to do this? He goes, I would say you should do it, but do what you want. Nobody tells you to do anything anymore. So I said, yeah, I'd love it. So he said, all right, I'll set you an appointment. Got back to me, got me in there, and that was it,
The key here is when someone's positive and they're at risk of getting it, you got to give it early. So within the first 10 days for sure, but even the first 5 days. So as soon as they have symptoms and they test positive for COVID and they meet the criteria, get that IV in, get the infusion in as quickly as possible. We're glad we're able to get you in. So, you're a busy guy, lots going on. What motivates you to take your time to talk with me about this?
The people around me that got COVID, I'm the only person I know that got the infusion. So all the people around me, which is probably 20 people I know that got COVID over the past whatever, all of them had a much rougher ride according to what they said to me. None of them had an easier time than me. And I'm the one with a heart condition. And I was probably the oldest one too. You know what I mean? And I'm not some big healthy guy. So that just shows how the infusion worked.
What did you feel when you got the actual infusion?
I mean, afterwards, it was pretty quick. When I started to feel better, I was like, wow, this is really working. Suddenly I was like on my phone. Suddenly I was feeling better, walking around I wasn't going outside, but I felt much better, just different. The nausea went away, everything.
Last question for you from me is, give me your 30-second elevator pitch now that I can, you're a man that communicates with the masses. Give me an elevator pitch.
You know what I mean? I don't know why people would resist this because it's such a positive thing. And it's better to play it safe, in my opinion, because, you don't want those clotting things, Right. But I feel like it saved me from really bad lingering COVID. For me, it really worked.
I encourage everyone to, treat.